The NASDA meeting was a really fortuitous opportunity for me. Early in my tenure, maybe the first couple of weeks, I had the opportunity to talk to the NASDA president at the beginning, and he mentioned that their produce safety consortium, which is held once a year, this year is going to be in St. Louis. All 50 states are there, and these are the state ag department generally, sometimes health department staff who partner with us to implement one of our most important regulations, the produce safety rule. To me, it just seemed like a perfect opportunity to get out and meet many of the people who we partner with to implement one of our most important regulations. And so I went to St. Louis. There were 250 people there. Maybe 30 of them were from FDA and the rest were from states. I think virtually all 50 states were represented. So it was a great opportunity to be with people who we are partnering as part of the food safety enterprise to get this important work done. I don't think that when most people, even at FDA, are aware that our produce safety rule, which is again is one of our key FSMA requirements, is actually implemented by states. Again, often ag departments, sometimes health departments, and that means it is a state employee who is going onto a farm to inspect to ensure that the requirements are being achieved. Pretty clearly, if we're going to have the success that we want to have, we have to be close partners with the people who are doing this work. And that's really what this consortium, what this meeting was about. It was really gratifying to see this, what I refer to as a community of practice. People who fundamentally have the same job, they're just doing it in a different place. They may be doing it a little differently, in different geographies, different types of farms, but fundamentally they have the same kind of job. All walks of life, there are these communities of practice. I think it's really important for communities of practice to exist, for people to get together, to share about what their struggles are, what their successes have been, and basically just share what's working and what's not working. I really think it's important to be with the people in our organization who are doing the work, often in the field, often in laboratories, to really understand sort of what their realities are like, especially during this time of our reorganization. And so I went to Kansas City from St. Louis to spend a day with the team there. Not surprisingly, it was incredibly educational for me. What impressed me the most, and actually was true in the Alameda facility as well, is just how integrated our laboratories are with the work that we're doing. Virtually everything that I looked at was related to not just something that we might be doing next month or next year that we want to be ready, but something we're doing right now. And the total diet study, where we're basically pulling a market basket of food from around the country and actually turning it into the recipes people use in their real lives, and then taking measurements from it. And that's how fundamentally in the centers we do our analysis and trying to understand what do people eat and what they may be getting with their food. There were also staff working on some of the heavy metal issues that we're struggling with right now. You may recall that in my trip to Salinas, we were talking with stakeholders about closer to zero, and some of the work that's relevant to closer to zero is being done in Kansas City. So it's just kind of remarkable how much nexus there is, which is really important, that the work being done in our laboratories are supporting the work of the center. So whether it is they're looking for a heavy metal in a product, or they're looking for a bacteria that you don't want to be in a fruit or vegetable, that is where that analysis is done. And so when we're reporting to the public on a matter related to food safety, either chemical or microbial contamination, the reason we know it's there is because it was brought to the laboratory by one of our field team and analyzed in a laboratory by our laboratory staff. These laboratories are designed to work hand and glove with the center to achieve an objective. And here the objective is food safety, and that is what they're doing. And so whether you are an industry stakeholder, a taxpayer, a consumer advocate, a government watchdog, Congress, you should be happy to learn that that is how our labs are working with our center, that we're working together to achieve the objective that Congress has required us to do, which is ensuring food safety. Thanks for joining me. And next time, I will be traveling with FDA Chief Scientist Dr. Namanje Bumpus to visit our laboratory in Queens, New York.